as you probably guessed, this video is about how you can leave bedside nursing by 2025, and this is going to be a 3-part series. So if this is something that you're interested in, if you're a bedside nurse looking for a way out, you are burnt out and you know that there's got to be more options out there, go ahead and stay tuned to this video. Hi, my name is Courtney Noel. I'm a registered nurse. I've been a registered nurse with 15 years, with the last 7 of those years being in utilization review and case management. And I help burnt out bedside nurses transition into specialties like utilization management and case management, most of the time remotely. So if that sounds like something that you're interested in, stay tuned to this video, and I'll also have my contact information in the drop box. Let's get into it. So how can you leave bedside nursing by 2025? This is going to be a 3-part series. This particular video, we are going to talk about mindset. And I know it's like kind of cringe when you hear that, like mindset, if you want to change mindset. But honestly, it's true. Like, you have to change your mindset when you are trying to make a big change in your life, whether that's personal or professional. So the number one thing you have to do is change your mindset about how you see nursing and how you see your career in nursing. So we're going to talk about 4 things that I think that you should think about when you think, before you even start to pursue a specialty outside of bedside nursing, okay? So first of all, you need to know your why. Why do you want to leave the bedside? Why do you want to make this career shift? Is it because you're burnt out? Is it because you want work-life balance? Is it because you have personal issues? Or is it because you just want to do something new? That is all good. Whatever your why is, it doesn't matter. As long as it's personal to you, you need to have that, because sometimes the journey to transitioning from bedside nursing to something, a specialty like utilization or case management or CDI, something that is not patient facing, it can be a challenge because there is a process. Sometimes there are things that you hadn't even thought about, or sometimes it can get discouraging. You can be sending out 1 million resumes and never get a call back. So you have to know your why, so it helps you push through the not so favorable times. So number 2 is finances. You need to wrap your mind around, not saying that this is always the constant, but in most situations when you are transferring or transitioning from a bedside acute care position to something like utilization review or case management, baby, there's a pay cut. Okay, let's just be completely clear. There's really going to be a pay cut, because 9 times out of 10, you're working, you're getting, good pay as an acute care nurse, or even LTAC SNF, wherever you work. And then you go from, hey, I know I could pick up some shifts, I could do my 3 shifts, and then I have a per diem, all that jazz. But in most situations, when you transition from bedside nursing to utilization review or case management, you will take a pay cut, and it's a salary position. So the opportunities to really make that extra money, overtime, whatever the case may be, is not there. So you have to wrap your mind around the fact that that can happen. And I am here to be a witness to that. And that's why I say your why matters. For me, when I made the transition into utilization management, I was in California as a travel nurse. I had a travel contract, I had a per diem that I was working out there, and I had an agency. So I was getting 3 checks, but I was so burnt out that none of it mattered. But I had a plan. I had already paid down a lot of debt. My main bills were not a lot. And on top of that, I had a per diem job that I held down for 9 years that I could always go to if I needed to beef up my money, past the requirements of that per diem role. So I had a plan when I said, okay, it was time for me to transition into utilization review. So that way I didn't feel the brunt, for real, of the big pay shift, because a lot of times it's a pay shift. And I recently got a message on Instagram from a young lady who wants to leave the bedside and to come to utilization review or case management. She said she would go either way. And her question was like, how does she handle that big pay gap? And I told her what I did. Like I just told you all, I planned for it. I paid down a lot of bills. I also kept that per diem job. So even though I was working Monday through Friday, I would pick up the per diem on the weekends. So you know what I'm saying? I made sure that I had the monies until everything leveled out. And I kept that per diem for like a year or 2 after I got into the utilization review role. So I would say wrap your mind around finances when you think about transitioning into this type of specialty. Okay, if you see me looking down, I'm reading my notes. The next mindset shift that you have to change going from bedside nursing to something like utilization review or case management is scheduling. Baby, the most of us, we work in 5-8 hour shifts, but no weekends, no holidays. That's generally, but I'm not gonna lie. I was doing 312s and I also did 410s at one point, you know, because I used to work the PACU, so it could go either way when I was traveling. I'm not gonna sit here and lie to you. That was and still is the hardest transition that I had to make, going from bedside nursing to utilization review. That was the hardest switch because, baby, I love them days off. Baby, I do not want to be working. I feel like if I'm working every day, baby, I ain't doing nothing for myself. And it just, even to this day, I be like, what's the tea? So that to me is something that you have to take a mindset shift and know and be willing and be flexible to say, hey, this is something that I want to do for my career, my family, for myself, is switch out of bedside nursing and switch to utilization review, case management. That is something that you really need to think that, can you stand that? But the good thing about it is that you, for the majority of these roles, you have the weekends and the holidays off. So if you're a person, you have a family, you want to spend your holidays, you want a more normalized schedule, then it'll be just fine. But for me, it was a transition shift. Harder than the money was the schedule. So that's something I want you to think about when you want to pursue a career or a specialty transition into utilization review and case management. Okay, and so the last point I want you to also be able to wrap your mind around when it comes to the mindset shift of switching from bedside nursing to utilization review or case management is the learning curve. A lot of times, most times, nurses who are coming into these specialties, they have experience, and so they think like, oh, I could do that. That is easy. Like I could get that quick. But let me tell you, it's not as easy as it looks. Yes, we're not physically doing much as like we used to be doing at the bedside, but baby, mentally, it's a lot to make this shift, because we don't look at a plan of care for our patients like a nurse at the bedside. We look at it from more of a acuity resource standpoint. Like, is this person receiving the proper resource for this diagnosis, and are we transitioning this patient through our healthcare system appropriately to ensure that we're doing just due to the patient for their health, and also making sure that we're utilizing resources appropriately for reimbursement. Okay, so that's a mental shift, and I've seen it time and time again. Nurses come in thinking that it's easy peasy lemon squeezy, and they don't do so well. It's a hard shift. So you need to wrap your mind around being flexible, being open, and understanding that you may not get it really quickly. It may take you some time. But just like anything in nursing, when you switch to a new profession or new specialty, or if you switch to, or if you're a new nurse coming into the profession, it takes about a year to really get your footing. Takes about a year to really feel like you got this thing down pat, you're in a groove. So I want you to just be able to have that in your mind once you obtain the job, that there are some things that are going to come into play. So if you looked at those 3 or 4 things and you say, you know what, Courtney, you know what, I know my why, I'm okay with the finances, I'm okay with the scheduling, and I'm flexible, like I'm willing to learn, and I know that, you know, I need to be open-minded and be flexible in how I learn and how I receive information, then I would say that it is time for you to make the transition into this specialty, into utilization review and case management, and I am here to help you do so. If you want to transition and you have questions, any concerns, my information is in the description box. But I hope this information was helpful for you. If you please like, comment, subscribe, it really keeps me motivated to bring content to this channel. Most importantly, I love you, but Jesus loves you so much more. See you for part 2.